Marty Coleman. I'm an orthopedic surgeon. I specialize in shoulders. I wanted to talk about the experience at OSC for a condition which people will occasionally have and not know they have it. It's called a frozen shoulder, or another name is an adhesive capsulitis. But what it means is that the shoulder joint is not moving as fully as it should. Now, we differentiate between people who have damage to the shoulder such that they can't lift it. That's one condition. That can be a rotator cuff tear. But I'm talking about a person who, no matter how much you help them, the arm will not go past a certain point. And if they have no arthritis but simply have a series of adhesions around the shoulder, we refer to that as a frozen shoulder. Now, this comes in certain groups more than others. It's much more common in women. It can be insidious in its onset, meaning it comes on gradually. But when we see them in the office, typically what we find is that they will not be able to move their arm past a certain point, and they'll also have limitation of rotation as well. Now, this is a very tough problem. It hurts miserably, and it's unresponsive to conventional care in some cases. But we have a routine we follow trying to get people to get better with this condition. And the idea is to break free the adhesions that are keeping the shoulders stuck together. And what we do is we start with medication, which includes a painkiller, an anti-inflammatory, and often a muscle relaxer. We'll give them a cortisone shot. We'll put them in physical therapy. And even though it's a hard job, many people who have that presentation and that treatment will improve gradually, month by month, getting their motion back. Unfortunately, there's a subgroup that do not improve with this approach and have to go to surgery. And for those people, we'll typically do an arthroscopic evaluation to get rid of all the spurs, and then we'll physically move the shoulder to release the adhesions, and this is followed by more physical therapy. I want to emphasize that's the exception, but there are times where that's required. Unfortunately also, we have people who have a frozen shoulder on the one side, and then months or years later the other shoulder will develop the same problem. We don't really understand why it happens. The suspicion is that it's an autoimmune process, and we don't really fully understand that, but we don't know how to treat it. We do know how to treat it. We do know how to treat it, and we generally have happy people at the end of a long, strenuous treatment.